Hi, my name is Mohammad Banharally. First of all, I would like to thank Amy QT for giving me the opportunity to present this topic today. So the topic today will be tick-borne diseases. I know those little bugs sometimes will tick people off, so we're gonna see how they tick us off. Okay, so first things first, what is a tick? A tick is an arachnid, and it's very closely related to spiders. And people who have arachnophobia, they might be scared of these ones as well. Ticks tend to carry a lot of pathogens, for example, bacteria, viruses, and some parasites, protozoa. And we'll see that shortly in the slides upcoming. It's important to understand how ticks they cause diseases and how they transmitted it. And we are also seeing a lot of new cases of tick-borne diseases, as we'll see. Okay, some of the most common tick species that we have in U.S. is the classic Ixodes scapillaris, which is also known as the black-leg tick or deer tick, and usually they are the ones who are responsible for causing Lyme disease, and they can be mostly found in the northern part of U.S. and sometimes they're spread in the south as well. There's also a closely related one is the Ixodes pacificus, which is on the western side, so mostly on the California side. They also transmit Lyme disease, and both Ixodes they cause anaplasmosis as well. Next thing, we'll also see dermacenter, which is also known as the American dog tick. This can be found in the eastern part of U.S. and some part of the West, and it's very distributed around the U.S. And they are responsible for causing Rocky Mountain spotted fever, also known as RMSF, and tularemia. And lastly, we'll also see amblyoma, which is also known as the Lone Star tick. This will be found in the south, and they cause a lot of other diseases. So here we have an illustration of the ticks that we just talked about. So the first two ones, the black leg tick, those are the ones that cause Lyme disease, and they can be distinguished by this circle that they have on their back. I suppose the name scapularis would indicate maybe that's where the spot would be. I couldn't find anything that would explain why it's called scapularis. But anyways, the other three over here, the American dog tick, the Rocky Mountain wood tick, and the Gulf Coast tick, all three of those are responsible for the RMSF, again, the Rocky Mountain spotted fever. And the last three, they tend to cause other diseases, for example, tularemia, babesiosis, and all that. Okay, here I have a little video to show how horrific tick infestation can be. Sorry, yes. As you can see, this short video, we can see how Lyme, how ticks can cause diseases. So moving forward, the most popular disease caused by Lyme, most popular disease caused by ticks is Lyme disease. So usually it's caused by the Borrelia burgdorferi, which is a spirochete, and it's very closely related to the other spirochetes. For example, syphilis. The early symptoms for Lyme disease is erythema migrans, which is characterized by a target rash. As you can see on the right, it has the shape of a target or a bullseye, and people usually experience fever, chills, and muscle aches. After a few weeks, people start getting more of those rashes all over their body, and they start feeling neurological symptoms, for example, headaches, dizziness, and Bell's palsy. So, in 5% of patients with Lyme disease, they often experience Bell palsy, and it's usually bilateral. And they also can get meningitis and encephalitis. Those are the inflammation of the meninges and the brain, respectively. Pericarditis, myocarditis, and atrioventricular block. And this atrioventricular block is usually it's a third degree block, and it is reversible with medication. And lastly, it's patients can have lymphocytoma. It is very rare, but it is possible, and usually it's in African subcontinent that has this. And lastly, if it's untreated for a few months or years, people will experience knee pain, encephalomyelitis, and acrodermatitis chronica atropicans. So, acrodermatitis chronica atropicans is the thinning of the skin of your hands and of your soles. Here, this illustration shows how the Borrelia makes its way to the target tissues. So after the bite, the bacteria spreads from the saliva all the way to the blood, and it moves to all the organs responsible. For example, to the knee, to the brain, to nerves, and to the skin. Also to the heart, and also to the face. Okay, to continue, how do we diagnose Lyme disease? So at the beginning, it's hard to find something in the blood, so we usually go by clinical symptoms and a history of tick exposure. Afterwards, after some time, we can check for Borrelia in the blood by performing serological testing, which would be immunoassay or immunofluorescence. And if we still can't find the responsible pathogen, we usually use a Western blot to find out. And in cases of people with Lyme disease, if they are presenting with meningeal symptoms, what we do is we perform a lumbar puncture to rule out any other causes. The treatment for Lyme disease is usually doxycycline. So if a patient is above 8 years old, we can safely give them doxycycline. But if the patient is under 8 years old or they're pregnant, we avoid giving them doxycycline because of the teratogenic effects of doxycycline and the teeth discoloration that doxycycline may cause in these patients. And if the disease is disseminated, so which means it has affected many parts of the body, for example, if patients they show arthritis, carditis, meningitis, encephalitis, and so on, we treat them with IV ceftriaxone. Lastly, when treating Lyme disease, because they're spirochetes, similar to syphilis, they can cause a reaction called Jarisch-Herxheimer reaction. Okay, the next disease is Story. So Story, it's a similar disease to Lyme, but it's a bit milder, and it's caused by Borrelia lone Story, and it's caused by the Lone Star tick. So it's the same, almost the same thing as Lyme disease. It's diagnosed clinically, and there's no diagnostic test for this one because it's still debated as to what causes Story. but the treatment remains the same as Lyme disease, and it's using doxycycline. The next disease would be Rocky Mountain spotted fever. This is a very popular disease that comes up on the boards, and it's caused by Rickettsia rickettsii, and it's via ticks. Rocky Mountain wood tick, the brown dog tick. And initially, patients they present with fever, headache, and a maculopapular rash, or it could even be a petechial rash. And the reason why we have a petechial rash is this this Rickettsia rickettsii it causes the symptoms via vasculitis. And as we know, with vasculitis, it causes an inflammation of the blood vessels, and it increases the permeability of those blood vessels. And this is the reason why some patients might present with hyponatremia, which would indicate very severe disease. And of course, the inflammation could cause DIC and thrombocytopenia. And if untreated, it might even cause death. Similarly, if the diagnosis is clinical, and if we wanted to confirm the presence of Rickettsia rickettsii, we could perform a serology or PCR. And the treatment would still be doxycycline, even in children. So this is a small illustration. It just shows you how it will affect the endothelial cells, and it's pretty much a small vessel vasculitis. Okay, and there are differential diagnoses to RMSF because it shares a lot of symptoms with other diseases. For example, meningococcal meningitis. This also presents. This condition also presents with petechial rash, fever, headache, nuchal rigidity, and so on. And this disease progresses much faster than RMSF. Next, we have endemic typhus, also caused by rickettsia. It has similar rash as RMSF, but it's milder, and it's not caused by a tick. It's caused by a body louse. Next, we have secondary syphilis. As we know for RMSF, the rash begins at the ankles and at the wrist, but for syphilis, it is believed to start at the palms and soles, and then it spreads inwards. And people usually have a history of sexual contact instead of having exposure to ticks. And lastly, we have West Nile virus. It also has a rash on the extremities, fever, headaches, myalgia, same as RMSF, but this one would be caused by a mosquito. And usually, it's birds that are the reservoir for this virus. Oops, sorry. Okay. There's a condition called tularemia, and every time I see tularemia, I think about Bambi and Thumper, and it's usually caused by a dog tick. And some people when they go hunting, when they handle wild animals or game, they sometimes they can present with tularemia. So tularemia can present in different ways. Um, there's ulceroglandular disease. I'll show you on the next slide how it looks like. So as you can see, there's a marked lymphadenopathy. It's very big, especially on the neck, and it also forms ulcers. So many skin ulcers on the body. It could be anywhere, but usually it's at the bite site. Um, Oculoglandular disease. So this would be we would have lymphadenopathy very close to the eyes, and as you can see here, there's a white spot. There's yellowish white spots on the eyes, and that would indicate conjunctivitis. So again, for tularemia, the diagnosis is mostly clinical, but if you wanted to confirm, it would be through culture, PCR, serology, and all that. And the treatment would be streptomycin, usually antibiotics. Okay. We have tick-borne relapsing fever, another one. It has a febrile episode, so it's very similar to malaria. How malaria has like a period where there's no symptoms, and then whenever there's hemolytic anemia, then the patient will feel the fever, headache, and muscle aches, and all those symptoms. So it's very similar. And we do a blood smear to to find the pathogen responsible for this. And again, the treatment would be tetracycline, doxycycline, or erythromycin. Uh, there's another condition, babesiosis. This is caused by Babesia microti, and it's the typical features are fever, chills, sweating, muscle aches, but the standout thing is the Maltese cross sign. So if you look at the on the right on the blood smear, you can see there's a tetrad over there. So this usually indicates that this patient has babesia. And the way we treat it, it's through atovaquone, and you could use azithromycin or clindamycin. And the reason we use atovaquone, it's very similar to malaria. Okay. Next is anaplasmosis, again also caused by tick, and those the symptoms are very very similar to the previous ones, and it's just headaches, muscle aches, nausea, fatigue. It's very general symptoms, and treated by doxycycline. Similar with ehrlichiosis, very similar to the previous ones, and it's caused by the Lone Star tick. Colorado tick fever. It's also it cause every tick disease so far that we've seen, they present very similar. So Colorado tick fever is also another one, but this one is caused by a virus instead of Borrelia. Powassan virus. It originated in Canada, in Ontario. There's a small city called Powassan, and they first discovered Powassan over there, and it tends to cause encephalitis, meningitis, and other neurological symptoms. And in some cases, they found people who have this virus, it's fatal, and there's no way for us to treat it because it's a viral infection. And this alpha gal syndrome is a it's one of those syndromes that really baffled me. I didn't know how a tick could actually cause you to have a reaction to red meat. And the way this happens is the tick would be living in the host, and they would feed off on their blood, and eventually they will acquire this alpha galactose. And whenever they will bite us, they will introduce the alpha galactose into our system, and the body would become sensitized the same way as an allergy would be formed. And anytime and the subsequent time, the next time we eat red meat, our body will recognize this as an allergen and would mount a an allergic reactions. And as you can imagine, the symptoms that would occur from this would be, would be allergic reactions, hives, abdominal pain, and it could even progress to anaphylaxis, shortness of breath. The way we diagnose this is we look for antibodies against alpha galactose. And treatment, there's not much treatment that can be done. It's mostly we need to avoid red meat as much as possible and any products that may have alpha galactose. And if ever there's an allergic reaction or anaphylaxis, we would treat them with antihistamines or epinephrine. Tick-borne paralysis. This one was also an interesting case. Essentially, the tick would bite a person, and over a few hours or days, if it stays attached to the host, they will start experiencing muscle pain and paresthesia. And after some time, patients will experience flaccid paralysis, loss of deep tendon reflexes, ataxia, cranial nerve palsies. It could be double vision. It could be trigeminal neuralgia. It could be anything to do with the cranial nerves. And eventually, if it's not removed, a patient could end up with respiratory failure and death. And this tick-borne paralysis, it's often mistaken for Guillain-Barré syndrome, which is usually a peripheral disease, but it happens much faster. It occurs within 3 to 7 days, and the treatment would be to remove the tick as soon as possible, and supportive care in case the patient is having difficulty breathing, if their respiratory muscles are affected by this neurotoxin from the tick. And this is how they typically remove it. Okay, moving on to the next slide. Sorry about that. Okay, and the next thing would be how to prevent tick bites. So, as we've seen in previous videos, we need to be as covered as we can and make sure that we tug our pants inside our socks so they don't crawl up our ankles and up to our feet, legs and feet. Um, we need to use insect repellents because that way we can keep them away from us. And whenever we go outside, any outdoor activities, anything like that, any hiking, uh, we should we should perform body checks to see if there's any ticks attached. And when it comes to environment, just keep grass vegetation trimmed and use pesticide as much as we can. And lastly, for Lyme disease and other tick-borne diseases, it's best that we spread awareness on the different diseases that ticks might cause. And any questions?
Thank you. It was a nice presentation. I would prefer it to be a little less dense, but that was all right. I really like the alpha-gal syndrome. This is a new reason to avoid ticks because I cannot imagine my life without red meat. So thank you for this information.
Yeah, I feel like this would be the if vegans had to do world domination, they could do it through ticks,
Yeah.
through alpha gal.
Oh, thank you. Okay.